Electronic cigarettes or e-cigarettes, the current outbreak of lung illnesses associated with e-cigarettes, and the youth vaping epidemic are a front and center health concern in the United States, and particularly in my state of Oregon. In recent weeks, an as yet unidentified lung illness has killed 7 people, sickened more than 500 across 38 states. As we will hear from Dr. Sharpless and Dr. Schuchert today, the investigation of the cause or causes of the illnesses is ongoing, but it appears to be vaping related. Many of the individuals who have gotten sick seem to have used black market products that contain THC. Earlier this month, public health officials in Oregon announced a person who died in July of severe respiratory illness had used an e-cigarette containing marijuana oil purchased from a licensed dispensary, meaning that product sold in the store should have gone through a testing process regulated by the state of Oregon. It was the first death in the U.S. tied to a vaping product bought in a marijuana shop. Much is still unknown, however, including which dispensary sold the product and whether it was contaminated or whether something was added into the liquid into the device after the purchase. In July, an 18-year-old young man went to a hospital complaining of breathing problems. Within 48 hours, he was sent to the intensive care unit, diagnosed with acute respiratory distress syndrome, a condition associated with acute lung injury. He was connected to a breathing tube and placed in a medically induced coma for a week. Later, the patient's mother found an e-cigarette cartridge with the label of a licensed company based in California that sells THC products. However, the cartridge later was found to be a counterfeit of that company's product. In North Carolina, 5 individuals bought the marijuana oils that made them sick on the street from unlicensed and likely illegal dealers. All 5 hospitalized, 3 in intensive care. It took a battery of tests to figure out that all 5 had acute exogenous lipid pneumonia, that's lung inflammation caused by breathing oil. Luckily, the individuals in New York, North Carolina survived, but not all been so lucky, including the individual from Oregon who died. These cases of young, seemingly healthy young adults getting sick after vaping are piling up far too quickly. These cases are shining a light on the youth vaping epidemic in the United States. The most recent data from the National Youth Tobacco Survey, it's very troubling. About 27.5% of youth reported using e-cigarettes in 2019 compared to 20.8% in 2018. That's an 11.3% jump in just 3 years. Given these trends, the administration, the Trump administration, the states, and this committee are right to look for solutions to curtail youth access to e-cigarettes. So I appreciate the Trump administration's pursuit of an effective solution to the problem of youth access, as well as the partnership between the administration and the states to investigate these outbreaks of lung illnesses. However, there's another overlay to the e-cigarette problem, that's counterfeit products, including counterfeit THC products. Bootleg THC cartridges are becoming too common on the market, with vendors advertising counterfeit and bootleg products on social media platforms such as Snapchat and Instagram. And according to press reports, the states that appear to be the most inundated with counterfeit THC products are states where recreational marijuana is legal. According to the California Department of Public Health, there were 28 potential cases of acute lung disease among people who had recently vaped cannabis products. In August, the California Department of Public Health reported a cluster of at least 7 healthy kids in King County, California, all admitted to hospitals with symptoms of severe lung disease, and all 7 were linked to THC vapes that had been purchased from the black market. Lab tests conducted by a third-party testing company showed common contaminants in the counterfeit vapes, including pesticides, a fungicide, that when vaporized converts into a substance used as a chemical weapon by the French during the First War, World War I. In addition to the ongoing work, we need a full investigation into counterfeit THC cartridges, Madam Chair, as well as the vaping and cannabis black markets. That needs to be part of this investigation. So let's get a full set of facts to ensure we get it right when we move forward on policy solutions.